2025. Members present, we have Councilmember Benton, Bradford, Nash, Porterfield, Vice Chair, Prep-T, Weiner, and Huffman. We're going to get started today really quick with a consent agenda. So I'm going to read through these items. Just before I do that, I am leaving everything on consent unless anybody needs to pull anything except items 1, 2, and 10. Those will not be on consent. All right, starting at the top of the consent agenda, item number 3, RS 2025-1557, sponsors Toombs, Huffman, Welsh, Hill, and Allen, a resolution approving Amendment 3 to an adult drug court and veterans treatment court discretionary program grant from the U.S. Department of Justice to the Metropolitan Government acting by and through General Sessions Court to implement a DUI court to serve participants convicted of a misdemeanor DUI offense. Item number 4, RS 2025-1560, sponsors Toombs, Huffman, Welsh, Gadd, Swara, and Allen, a resolution approving Amendment 1 from the Tennessee Housing Development Authority to the Metropolitan Government acting by and through the Metropolitan Action Commission for Low-Income Home Energy Assistance Program, LIHEP, EAP, I butchered that acronym, services targeted towards the elderly, disabled veterans, and households with young children. Item number 5, RS 2025-1570, sponsors Toombs, Huffman, Welsh, and Hill, a resolution accepting a direct appropriation grant from the Tennessee Department of Health to the Metropolitan Government acting by and through the Metropolitan Board of Health to implement and coordinate HIV surveillance and prevention activities and services focusing on high-risk populations. Item number 6, RS 2025-1571, sponsors Toombs, Huffman, Welsh, Gadd, Swara, and Allen, a resolution approving Amendment 1 to a grant from the Tennessee Department of Health to the Metropolitan Government, acting by and through the Metropolitan Board of Health to provide supplemental foods, nutrition, education, and breastfeeding promotion to eligible persons through the Women, Infant, and Children Program. Item number 7, RS 2025-1576, sponsors Toombs, Huffman, and Hill, a resolution approving Amendment 1 to a contract between the Metropolitan Government of Nashville and Davidson County and Image Trend LLC to provide EMS and fire department data collection and reporting software. Item number 8, RS 2025-1577, a resolution appropriating a total of $385,000 from the Metropolitan Government of Nashville and Davidson County, acting by and through the Office of Family Safety to the Nashville Children's Alliance to receive American Recovery Plan Act funds. Didn't read the sponsors there. I apologize. Sponsors Toombs, Huffman, Welsh, Gadd, Swara, Hill, Allen, and Stiles. And lastly, on the consent agenda, RS 2025-1578, sponsors Toombs, Huffman, and Gadd, a resolution accepting a grant from the Tennessee Department of Finance and Administration to the Metropolitan Government acting by and through the Metropolitan Nashville Police Department to reimburse costs associated with emergency mental health patient transport under TCA 33-6-406. Does anyone need anything removed? Council Member Prep-T.
Thank you, Mr. Chair. Could we remove number 7, RS 2025-1576?
Yes, sir. Thank you, Vice Chair. Anyone else? Do I have a motion on the consolidated agenda? All those in favor, aye. Opposed, no. Anybody not voting? Okay, that'd be 7 in favor, no votes, no not voting. Okay, gonna take these, I guess I can read both of these. Yeah. So items 1 and 2, I'm going to read both of these at the same time. Both were deferred in the Budget and Finance Committee. I'll also give a brief explanation why, and I'll give Captain Young the ability to speak on this as well. Item number 1, RS 2025-1533, a resolution approving a Homeland Security Grant Program application from the Tennessee Emergency Management Agency to the Metropolitan Government, acting by and through the Office of Emergency Management to fund efforts to prevent, prepare for, protect against, and respond to acts of terrorism and other catastrophic events. That sponsors Toombs, Huffman, and Benton. And then item number 2, RS 2025-1534. Once again, that's Toombs, Huffman, and Benton, a resolution approving an Urban Area Security Initiative UASI grant from the Tennessee Emergency Management Agency to the Metropolitan Government, acting by and through the Office of Emergency Management to fund costs related to enhancing security and the resilience of high-risk urban areas by building, sustaining, and improving capabilities to prevent, prepare for, protect against, and respond to acts of terrorism. Both of these items were deferred 2 meetings in Budget and Finance. Mr. Young, I don't know if you wanted to comment on that at all.
Thank you, Chair. Just real simple. It's basically tied up in the government shutdown. It's pretty basic. That's what it is.
Yes. Councilmember Porterfield, you are recognized.
Thank you, Chair. Move for a 2-meeting deferral for RS 2025-1533 and RS 2025-1534.
Do I have a second? All those in favor, aye. Opposed, no. Not voting. Item passes 7-0. Next item not on consent, item number 7, RS 2025-1576, sponsors Toombs, Huffman, and Hill, a resolution approving Amendment 1 to a contract between the Metropolitan Government of Nashville and Davidson County and Image Trend LLC to provide EMS and fire department data collection and reporting software. Let's see, I think Councilmember Vice Chair, yes. Do I have a motion for approval? Yep, second. Councilmember Prepty, you're recognized.
Thank you, Mr. Chair. In reviewing this contract and the particular phrasing of this resolution, whenever it says data collection, my ears perk up. And I don't know if Chief Young would be able to directly answer this in digging into this contract. Essentially, I've got a series of questions that I haven't fully formed in my mind, but I guess the first one primarily is, what are the particular services that that fire and EMS will be getting, and what is the data that's being collected for fire and EMS?
Mr. Young, you're recognized.
Mark Young, Nashville Fire. So we currently use this software now. What you're looking at here is a couple of reasons it's before you is, 1, an address change of fire headquarters, and 2, a module that we very much need to make the software more usable while we are out, for instance, making inspections on the street. We can actually now, if we gain this module increase into the software program, we can actually do all of our reporting at the scene instead of going back to the station to make those reports. It collects a lot of stuff. We use it for the inspection purposes, for our EMS and fire reports. It's mostly all the business of the Nashville Fire Department is in Image Trend software.
Those are my questions. Thank you, Mr. Chair.
Yep, thank you, Vice Chair. Any other questions? All those in favor say aye.
Aye.
Opposed, no. Any not voting? Item passes 7 votes in favor, none not voting. Last item on the agenda today is item number 10, BL 2025-1061, an ordinance to amend Title II of the Metropolitan Code of Laws to establish the Metropolitan Animal Care and Control Commission. I would lead a list of sponsors, but it is a mile long. Do I have a motion?
So moved.
Do I have a second? Okay, Councilmember Weiner, you're recognized.
I think you want me to move the amendment. So I would like to move the amendment.
Okay, do I have a second on the amendment? Okay, you're recognized.
Thank you. The amendment is nothing more than adding a couple of whereases to posture historical perspective so that there's more clarity around what we're doing.
Do I have a motion to move as amended now? Yep. I'm sorry. Thank you for the clarification. Yes, we got to vote on the amendment. Yes. Yep.
So I'd like to call for the question.
Yep. Okay, all those in favor say aye on the amendment. Vote no. Any not voting? Okay. Now back to you as amended.
Thank you. I'd like to move the bill as amended.
Do I have a second? All those in favor say aye.
Aye.
No discussion, I'm sorry. That, I got a little ahead of myself, Councilmember Porterfield, thank you.
Is there any discussion?
Yep, is there any discussion? Yes, ma'am.
Thank you. Thank you, Councilmember, for bringing this. Do we have any information from the Health Department if they've taken a position on this?
Do we have anyone from the Department of Health that would like to be recognized?
Hi, Cabrera Leach, Health Department. As for a position, we are extremely grateful and work very often with Councilwoman Weiner, as well as a lot of the co-sponsors on this bill. We would just like a little bit more time for specifically our Board of Health and our director to look at the language of the bill, because the planning process for this occurred like mainly with certain members of our staff, and we don't not support it. There's just a lack of understanding at our governing body level as to like what this is, and there's a short like notice with which they found out about this, and would just like to get a little bit more time.
Councilmember Weiner, you're recognized.
Thank you. With all due respect, I'm going to disagree. Hang on. Now my phone's not ringing in my ears. So this has been worked on for a good part of a year. I have met with initially Dr. Ariola and John Finke and Tom Sharp and the rest of the group. I have had individual meetings with each one of them. Dr. Ariola probably not as recently, but everybody else. We have been through this line by line by line. In fact, when I pulled it from the last time, it was because there was a recommendation, I don't know if it was from the health department or from the administration, but that we should sunset this commission upon the creation of the facility that we're looking towards. That is counterproductive to what this group needs. We have had 25 years of neglect of this entity, and we have staff members that are suffering physically, emotionally. We have pets that have suffered. It is not a healthy environment for a myriad of reasons. Now, I'm going to give this administration in the health department their due, because were it not for Dr. Ariola and John Finke and Tom Sharp and crew, these guys wouldn't have even gotten a raise. So kudos to them. But we want to make sure that for the future, for this group, we have a core entity that is created by ordinance that supersedes people. Because what happens if any of the people that are at the Board of Health right now leave and we're back to where we were? And that's not fair. And I can say that I'm very passionate about this, because I witness multiple times, every time I'm there, when I am doing the evaluation that I did for them, that there are systemic issues that are not the fault of the staff. These people do more with less than anybody I've ever seen. I sent the amended document the day Director Darby gave me the amended document. I sent it to everybody. How long ago was that? I can't find it in my notes, but I know it's been at least 3 or 4 weeks. I didn't hear back from a single soul until this afternoon, along or about, I don't remember, 1 o'clock, 2 o'clock this afternoon, asking me to defer this. And guys, I don't see any rational reason to do that. Thank you.
Ms. Leach, you're recognized.
Thank you. Well, that is the key issue there. The conversation that was had with Dr. Ariola with the original language of that bill, that is accurate. The new language that's contained within this bill, I don't think that he has seen, and he's currently outside of the country. The email that was sent to that person was the director of our Metro Animal Care and Control, which is like great. And I think that they'll be working very closely, or at least they should be, as well as John Finke, the director of environmental, with this Metro Animal Care and Control Commission. But as far as our actual leadership, if the director hasn't seen the language, the new language, and it was only shared with us very recently, not through Councilwoman Weiner, but due to other means or other lines of communication, it did not reach us. We're just asking for the time to examine the language in the bill, to present it to our Board of Health at our next Board of Health meeting, which is coming up, I believe, on the 18th of this month, November 13th. And then come back here like for that. We would just like to be able to see this because the language is not something that necessarily we are against, but would like to have more clarity on what role this commission serves. So I think that I'll give it up. Would you like to?
Really quick, I'm going to go back to Councilmember Weiner and Councilmember Bradford. I saw your hand up, so we'll come to you next. Councilmember Weiner, you're recognized.
For the record, the email was sent to Danielle Carter, John Finke, Tom Sharp, Dr. Ariola. Can't remember who else it was sent to, but it was a list of people. And then I sent it separately over to Danielle again when it was passed on first reading. So there's been a multitude of opportunities. I, in fact, got a read receipt on it from John Finke yesterday because I have read receipts on everything. Thank you.
Councilmember Bradford, you're recognized.
Thank you, Chair. So most folks already know how hard I've been working for MAC since I first got elected. I appreciate Councilmember Weiner for, stepping up and doing what she's doing with this. That's why I'm happy to sign on to it. What I'm hearing tonight, we hear all across the board from departments after departments. When we are trying to do the work of the people that elected us and to the people of the city, they try to throw in wrenches, to defer, to try and torpedo good legislation. To Councilmember Weiner's point, this issue has not just happened overnight. This has been a discussion going on for over a year with multiple people. This was on first reading 2 weeks ago. So I don't know why people are just now doing their job and reading their emails and trying to talk with folks about this, but these types of delays, they have to stop. The hardworking men and women at MAC have been working their fingers to the bone, providing humane care for our city's unhoused animals, going out of their way many times. It is time that we step up, give the people at MAC the support they need. Because quite frankly, they're not getting it from the health department. And so MAC needs this commission. They need all the help they can get so that we can help them help the unhoused animals in this city. Thank you.
Thank you, Councilmember Bradford. Department of Health, I'll recognize you. If you could just please say your name and title.
Good afternoon, everyone. My name is Tanae Hamilton Franklin, and I'm Chair of the Board of Health. I have been Chair of the Board of Health for about 3 years now. I've been on the board since February 2019. Since I started my tenure on the Board of Health, I have engaged with our MAC leadership, continuously learning from them, getting to know individuals in the office, if you would, non-traditional office, and understanding what their needs are. I have brought those concerns and incorporated them into board asks. But more importantly, I have incorporated them into what I sort of call just sort of making sure that we keep abreast of what is going on, what the critical points are that we need to pay attention to in MAC, and also where we need to lean in on support. We have heard, and thank you, Councilmember Weiner, for acknowledging that we have paid attention to competitive salaries, making sure that our workforce stays safe by making sure that we have made those accommodations. I'm here today because I received a phone call about an hour and a half ago about the fact that this bill was on second reading. While I am very proud of our director and our executive leadership team over the course of the last several months since Dr. Ariola started his tenure at the department, I do know that sometimes communications fall through the cracks, particularly when you have a lot of balls being thrown at you all at once. What I am asking for, since I have only had a chance to review, I don't even know if it was the original or which one I saw Tom Sharp emailed me. I'm asking for the respect for the Board of Health, who has leaned in and been a champion for MAC. Even when we went through the director search, MAC was at the forefront of making sure that we needed the director candidates, we needed them to understand that this was our priority. What I'm asking for is to allow the Board of Health this time and this space to review the intent, review the language before our next Board of Health meeting on November 13th. That will enable us to be able to ask questions of Mr. Finke, of Danielle, of Dr. Ariola, just to make sure we understand all angles. And also, it would give us a chance to be able to engage with you, Councilmember Weiner and Russ, and Bradford, and anyone else that we need to just better understand. I really don't understand because I rely on the department to provide information for us. At each Board of Health meeting, we have an agenda line item for board requests of the department and departmental requests of the board. We ask, what do we need to know with regards to policy decisions that are coming down the pike? How can we advocate and support? And how can we just engage in dialogue? And that has not come to us. I don't know why, but I'm here representing my other colleagues on the board, and I'm respectfully asking that you give us the respect as a volunteer entity to at least understand the details that are in this bill. And so for that reason, I'm asking for a deferral for, I believe it's 2 sessions, and that should get us through our next regularly scheduled Board of Health meeting, which I confirmed today we do have a quorum for that. Thank you.
Thank you very much. Any further discussion? Councilmember Weiner, you're recognized.
All due respect to everyone involved, this is not a rush job by any stretch. It is not my fault nor anybody that has been involved in this that the Board of Health did not get a copy of it or was reviewed with them. It's not our fault. The council, as a body, wants to send a strong message to the folks that work at MAC, that we support them, that we advocate for them, and that we have their best interests at heart. And I think that's all I can really say about it.
Councilmember Benton, you're recognized.
Thank you, Chair. This is amendable on third, correct? No?
No, ma'am. Or no, sir, not without suspending the rules.
Okay. But the rules could be suspended.
In theory, yes. Yep. Councilmember Nash, you're recognized.
Would it be appropriate now to ask for a 2-meeting deferral?
Yep, is that the motion that's on the floor?
Yes, I understand Councilmember Weiner's desire to move this thing forward, but if you've been working on it for a year, I really don't think that 2 meetings to give their board a chance to look it over will you're going to get there. And I think just to give some deference to them, I'm making that motion.
Do I have a second on Councilmember Nash's motion? Vice Chair Preti, you're recognized.
Thank you, Mr. Chair. I'll second the motion and state that I greatly appreciate the lead sponsor's work on this, and I'm going to be signing on as a co-sponsor to this legislation because I think that it is vital that we do this work and that we support our Metro employees and those at MAC who are, as has been stated, are working their fingers to the bone on this. So I 100% support this legislation. We'll be signing on as a co-sponsor, but also think that it is important to ensure that the governing body that oversees this has ample opportunity to do their due diligence, provide us input. And so I support this legislation, but I'll also be supporting the motion for a deferral.
Thank you, Vice Chair Preti. Any other discussion? We're going to move to a vote on, oh, I'm sorry, Councilmember Bradford, you're recognized.
Move to table.
Do I have a
Motion
second
to
on that?
defer.
Do I have a second on the tabling motion? Okay, all those in favor, we're going to do a show of hands here. Oh, yes, that's correct. Yes, thank you. Thanks for throwing a procedural into this. Councilmember Bradford, so we're going to go back and forth. First off, we'll recognize Councilmember Bradford on why the motion needs to be tabled.
Thank you, Chair. We've heard from all sides, and, there's not much more that can be said other than there's been plenty of time for the parties that be to look at this. And when we are working with other departments on legislation, at the end of the day, we are the ones writing the laws that they have to adhere to. And in this case, we are writing the law. They can read it when it's passed, and they can conform to it once it's been passed. MAC has been an issue for years. People who work there are afraid to speak up and to ask for more help because they're afraid of retribution. They're afraid of being ignored. They're afraid of being called a problem. We need this commission so that they have the support that they need to do their job and that they have the help to ensure that we can get a new facility, we can get more employees, we can get better resources. We cannot wait another 2 weeks. The shelter constantly is over capacity, which is not good for the animals and is not good for the staff. We've got to move this forward. And that's why I moved to table the deferral.
Thank you, Councilmember Bradford. Councilmember Nash, you're recognized.
Thank you, Mr. Chairman. Again, I am a co-sponsor of this legislation. I support it. I know what you're trying to do, fully support what you're trying to do. But we do have other boards and commissions, obviously one for the health department that for whatever reason hasn't had an opportunity to review this together in one of their meetings and have discussion over it. I don't think that waiting one more month is going to harm moving forward with the intent of this bill. And it totally does away with any excuse that the Board of Health might have for not reviewing it. They've had their chance now. They've promised they're going to do it. And I just think fairness to that board who has a difficult job. All our boards, all these volunteers, great respect for it. And I think we need to show a little difference here. A two-meeting deferral, it will not kill this bill. And I think may, in the end, make it stronger.
Thank you, Councilmember Nash. So the motion that is currently on the floor is to table the deferral vote that was proposed by Councilmember Nash. So we're going to do this by hand. First off, all those in favor of the tabled motion. Yes, ma'am. Councilmember Porterfield.
Points of, procedural inquiry, maybe, I don't know the term. If we are voting yes, that tables the motion, so then we move forward with the votes. If we are voting no, then that does not table the motion, and then we get to vote on Councilmember Nash's motion to defer. Is that correct?
That's how I understand it, and I'm getting the nod. Yes.
Thank you.
Okay, so the motion on the floor is a tabled motion of Councilmember Nash's deferral motion. So we're voting on the motion to table that. So we're going to show of hands. A vote of all those in favor, raise your hand. Okay, there's 4 votes. Table. All those opposed. 3 votes. Motion is tabled. We're going to move on to the legislation as amended now. Believe we had a motion. I'd like just to renew that motion if that's okay, since we're a little bit out of order. Councilmember Weiner, you're recognized.
Thank you. I would like to renew the motion as amended.
Okay, all those, so we have a motion made and a second made. Councilmember Porterfield, you're recognized.
I would like to move for a one meeting deferral.
Okay, we have a motion for a one meeting deferral. Do I have a second on that? We have a second on that. Yep, no, we do. Yes, yes. Okay, so we have a motion for a one meeting deferral now. Any discussion on this one meeting deferral? Yes, Councilmember Porterfield.
Yes, I just want to second everything that we heard from Councilmember Nash and Councilmember Prepsy. And thank you to Councilmember Weiner and Councilmember Bradford. It pains me to stand up and to ask for this against the will of the sponsor. So it's really uncomfortable right now. But I do think that it's important that we hear from our Board of Health to give them the opportunity to review this legislation. And I think that there is a saying, what is it? I don't know if it's called a parable, but there's a saying, like if you want to go fast, you go alone. If you want to be successful, you go together. Y'all know what I'm talking about? I'm kind of messing that up. But anyway, what I'm trying to say is I think that if we could build consensus around this legislation, and even if we as council members can say, hey, we want to move forward with the legislation, we support the legislation, but we don't want to do that over the will of the people that are like doing this work every single day. So I think that it's better if we can actually give them the opportunity to just hear it and opine on it. Maybe that will lead to an amendment on third reading. If we do a one meeting deferral, then we have, then the first meeting in November becomes the second reading of this legislation. The health department will have the opportunity to hear it at their Board of Health meeting. And then the third reading of the legislation will come to us after the health department has already met. So then we can try to suspend the rules if there's an amendment that needs to be made. I respect everything that Councilmember Weiner has done. I respect Councilmember Bradford's advocacy on this. We shouldn't have favorite constituents, but one of my favorite constituents is a MAC volunteer, and I often hear about the struggles that they have had with overcrowding, the struggles with the washing machine that they were having, just literally all these things. We are aware of this. We are committed to fixing these problems. We are committed to getting them a new facility. We are committed to helping and supporting our employees. So this deferral is not against MAC or any of this work. We just want to give them the opportunity to be able to read the legislation, opine on the legislation, and bring any recommendations. So I ask this in the spirit of working together, if we could please move forward with the one meeting deferral.
Thank you, Councilmember Porterfield. Councilmember Weiner, you're recognized.
Anybody who knows me knows I don't dig in unless I think there's a reason to dig in. And there has been ample opportunity for the folks that have had all of the legislation, all of the versions of the legislation, to share it with the Board of Health. Somebody from the Board of Health may have considered picking up the phone and calling me, because I have reached out to everybody and then some. And so I'm a little discomforted that this is being pushed. I don't rush things. I'm probably as thorough as anybody, if not more so, because of my bent to be CDO. That's OCD alphabetically. Having said that, I'm going to dig in, because I think the right thing to do is to support this agency that has been overlooked by the Board of Health. Thank you.
Thank you, Councilmember Weiner. So the motion on the floor is a vote for a one meeting deferral, just for clarity. Any other discussion on the one meeting deferral? Okay, we're going to do a vote by hand again. All those in favor of a one meeting deferral, raise your hand. All those opposed? Okay, deferral fails 4-3. We're back now to the original motion, and back to you, ma'am.
I'm going to get really good at this. Let's move this as amended.
Okay, the motion on the floor is to approve this as amended. Any discussion on the bill as amended? Any discussion on the bill as amended? I do see somebody from the Department of Health that wants to be recognized. I will recognize you if you'd like. Go ahead.
Thank you, Tanae Franklin, again, Board Chair. I want to reiterate the spirit in which I drove down here at the drop of a dime. As soon as I received information, I was immediately responsive. Just like the board has consistently, at least I can only speak since I've been on the board, we have consistently been proactive in advocating for MAC, for resources with counsel in the community. We have not let MAC down. The Board of Health has not. The Health Department has not. And it is in this spirit that I would appreciate, again, us as a volunteer body who relies on communication through team members of the department unless counsel engages us directly, like I've engaged counsel directly. So I'm just asking out of respect for my Board of Health colleagues that you allow us time to get through our November 13th meeting so we can see and deliberate. We will not be able to deliberate unless we have a special called meeting. And as you know, that's really hard for volunteers, especially when we're playing whack-a-mole with public health right now. And MAC is part of public health and we care about MAC. And so I just wanted to reiterate the spirit in which I'm here. It is not to stop. It is so we can be informed as volunteers. And I look forward to having a conversation with any council member. I always do. I always make myself available. And regardless of what the vote is, I still look forward to a dialogue as we consider this as a community. Thank you.
Thank you, Chair Franklin. Any further discussion before we move to a vote? All those in favor with the motion to as amended, we're going to do a raise a hand again. So all those in favor? All those opposed? And any not voting? Abstaining? Councilmember Prep-T, I didn't catch a vote from you. You good? Okay. All right. So that's a yay vote, just to confirm, sir. Thank you. Okay. That item passes with 5 in favor, 1 against, 1 not voting. That's the last item on our agenda. Real quick, before we take off, just want to give departments a chance in case anybody has anything. I see Office of Homeless Services. I see Mr. Tucker back there. Anybody have any reports? Anybody from fire? Anybody, anything? Looks like Office of Homeless Services has some stuff for us. Vice Chair Prep-T, would you grab those handouts from Director Calvin and pass those out? Thank you. And you're recognized.
Thank you. Hi, Allison Cantway with the Office of Homeless Services. So I know they're being passed out right now. Thank you very much. I'll just go really quickly through the highlights for this month. We mentioned this last month, but we did host a 5K on October 3rd to support Metro Makes a Difference, and it was a success. We had 44 runners and walkers. Our department raised over $2,000. Every member of the OHS team participated, which means that we are one of only 4 Metro departments with 100% participation in Metro Makes a Difference, which we're very proud of. Additionally, a delegation of 75 officials from Oklahoma City are visiting Nashville as a sister city to sort of learn from Nashville. They're meeting with several Metro departments. I think they're here to talk about, transit and planning and East Bank and homelessness. OHS, other providers, our HPC chair will all be meeting with this delegation to discuss the significant investment and impact that Nashville has made in housing and homelessness and share best practices as Oklahoma City plans to improve their system. Staff from OHS, the mayor's office, Room in the Inn, and Metro Council met with the Nashville Rescue Mission today to discuss ways in which Metro can provide support to them. They are the largest emergency shelter in Nashville, and as such, they play a really critical role in our community. Metro is committed to problem solving with them so that we can ensure that they continue serving some of Nashville's most vulnerable residents. OHS has been working with water, local stakeholders, and landowners to offer services to folks in an encampment, unhoused folks in an encampment on Cement Plant Road. So a 30-day notice was given to the 8 individuals that are residing on the property a little over a week ago. And OHS has successfully housed 7 of them so far and are actively, working to provide services to the last remaining individual. And then lastly, OHS is really, looking forward to the cold weather shelter because as we know, the cold weather is going to come and we're the city's overflow shelter. We are really excited about some partnerships that we've been able to cultivate. Meharry Mental Health Cooperative and the Health Department will all be providing trained clinical staff on site at the shelter to respond to emergency medical situations and emergency mental health needs. That is so incredibly exciting for us because, as we know, our friends who are unhoused have a lot of health conditions that they need assistance with. And we also I wanted to plug that there are lots of ways to engage with us in our work. We are working with Nashville Fit magazine to host a community resource fair on November 20th. It is open to service providers and our unhoused neighbors. We're also hosting a clothing donation drive for the cold weather shelter on November 4th for anyone that's interested in donating, clothing for the cold weather. So heavy stuff, coats, hats, gloves. I wanted to give a couple of shout outs to council members. Councilmember Gamble, obviously the cold weather shelter is in her district and she's always been very supportive. And Councilmember Gadd asked if she in her own district could host her own clothing drive on that date for the cold weather shelter. And of course we said yes. So if any of y'all or any of your constituents you think would be interested in donating, it is extremely needed and those clothes, they go out the door quickly. They are very needed. I know I went really fast.
Thank you, Ms. Canaway. Anyone have any questions? I will also happily pass along that we in Hermitage are also doing a clothing drive. I have not told y'all that yet, but we're going to be doing that in coordination with our annual Christmas tree lighting. So that's December 4th. Anybody that's in the area, definitely check that out. It's at the Hermitage Library, but we will be facilitating that as well.
Thank you. That's great.
Thank you. Pastor Tucker.
Thank you, Mr. Chair. I want to introduce Gavin Cromwell. We're grateful for not only the council support, but the mayor's office support in our beginning of a study of the language access availability here with the city. Gavin is a new member with our team who'll be doing that. So at various times, we'll be reaching out to some of you and to others as we go through this process of trying to assess what we have now, the efficacy or veracity of it, and to make recommendations how to make it better. So if Gavin reaches out, please, we hope you'd reach back out to him. Thank you.
Welcome and very important work. Thank you, Pastor Tucker. Just 2 parting messages from me. It's a little late in the month, and I apologize for my tardiness, but October is Breast Cancer Awareness Month. I would be remiss if I didn't mention that. Our wonderful Metro Department of Health provides a lot of free and low-cost breast cancer screenings through partnership programs. So if you are interested in learning more about that, you can visit the Metro Public Health Department's website, health.nashville.gov, or you can contact them at 615-340-5640. Oh, yes, I will recognize you. Yes, ma'am. Go ahead.
Thank you, Tanae Franklin, Board Chair again. Thank you for acknowledging that. And I wanted to speak up because I'm a 5-year breast cancer survivor that was diagnosed at Nashville General Hospital. Okay, so it's not just the health department. Yes, the health department, education, but also please encourage individuals to go get screened at Nashville General Hospital. The most compassionate care, and our workforce at NGH and the Department of, at the health department are champions of breast cancer awareness. And I'm here today because of the health department, the work that our workforce has done, as well as the work that Nashville General Hospital has done. So I just wanted to say thank you, and thank you for allowing me to interrupt your comments.
Oh, no, thank you. Appreciate that. Lastly, and I said this last meeting, but if you've not gotten your flu shot, please do so. I will continue to guilt you into that. You can do that today in the lobby, so you don't have any excuses. With that, meeting is adjourned.